Coming.
Maybe. Here we go. All right. Hey, everybody. Welcome to Ask Our Vet, brought to you by Rockwell Pets Pro. Each week, we will be discussing the hottest topics in veterinary medicine and answering your questions. I'm your host, Mike the Voice Monkey, full-time professional voice talent and 26-year veteran of the veterinary industry, from kennel cleanup in high school all the way to RVT to specialty surgery practice. And we can't ask our vet without our vet. So, as always, joining me is Dr. Max. Dr. Max graduated from Tufts Cumming School of Veterinary Medicine in 2018 and has been working at the Village Veterinarian in New York since the summer of 2020. What's new with you, Dr. Max? Anything interesting going on this week or the last couple of weeks?
All good, Mike. Yeah, it's been a very interesting last couple of weeks. Happy to be joining tonight, and thank you all for tuning in. Things have been kind of crazy up here at the practice here in New York City. I guess starting with the COVID.
What's going on?
Stuff. Well, out of our 19-person practice, 3 of us have come down with COVID. Thankfully, everyone is doing better. It's really within the past 2 weeks. We had a couple technicians and a doctor test positive, have mild symptoms, and, they quarantined at home, doing better now and have tested negative. But that kind of put a scare in us, and we've just, been exercising caution as we had been up until this point. But, even did a more thorough cleaning, got some professionals to come in and just kind of, fully clean the place. And, we're just mostly doing phone calls with clients outdoors. They drop off. So a further restricted curbside service right now. Insofar as, we're not really going out to talk to the owners. We're mostly talking to the clients over the phone. So that's, I guess, from the human perspective, the craziness. And as far as patients and cases, there have been a number of crazy things. The one thing that comes to mind, this wasn't actually my case. I was seeing appointments yesterday, but one of the other doctors in the practice who was on surgery yesterday had this, I think it was an 11 or 12-year-old Yorkie mix, blind, had some arthritis. But what it really had, that was the reason for it coming in, was the largest inguinal hernia I've ever seen in my life, dragging on the floor. And, they did x-rays, they saw the guts and intestines kind of going, pooching through. And it was just maybe the size of a grapefruit and a half or something. So imagine a grapefruit size hernia, piling through on a, maybe 10, 11 pound Yorkie or something. It was
basically inside out at that point.
Inside out. Yeah. So it was pretty awesome to kind of just in between appointments, peek into the surgery and, see all the contents. Also had some mammary tumors. So that was taken care of as well. But I think what really caught my eye was that hernia. So that was interesting.
Tell everybody what an inguinal hernia is. People have heard of a hernia, but where would it be if there was an inguinal hernia?
Sure. Yeah. Hernias come in different flavors in the body. There's diaphragmatic, umbilical, oftentimes puppies, that's something that we take care of at spay or neuter. But kind of the inguinal canal is a little bit further down the body, more caudal. And that's just a little opening that sometimes can be a little bit widened and to the point where you can get, multiple loops of bowel that kind of herniate through. I imagine, I don't recall how long it was the case for this little guy, but I think that it had been there for quite several years at least.
Wow.
But had grown, it's not like a tumor in a sense of, more cells filling it up, but I think it just kind of got widened more and more, allowing more abdominal contents to pile through. So that was
Was it
exciting to see.
affecting the dog's ability to walk or
Yes,
digest food or?
yes, yeah, yeah. I mean, that was I think that's why they brought him in, because a lot of these times, especially for young pups, an umbilical hernia, for example, it could be reducible, and when you kind of poke at it, you can kind of push it with your fingers back into the abdominal cavity, and then it may kind of come back, when the dog is lying or dorsal, and kind of with gravity it falls down, and it may not be a huge deal, and some dogs actually live with them their whole lives if the owners don't feel like it's interfering with quality of life. But in this case, the dog was symptomatic, so something had to be done, and I'm proud of my colleague for getting it done. Personally, I would have been I honestly think I would have been too scared to do this. I would have referred to a board certified surgeon, but no, it was very impressive.
And it's fixed surgically. They were able to reduce it and close it all up.
Yes, sir.
Good. Yeah, it's always scary with a 12-year-old dog under anesthesia too, especially when
it's true.
Small and horrible and a chronic condition. It's
no fun.
No.
Speaking of necrotic conditions, I saw a patient earlier today. It had a perineal urethrostomy, or PU, as commonly known, and so that's kind of this guy had a lot of stuff going on. It was only 10 years old, a little Pomeranian, and he has a lot of stuff, a lot of issues: heart murmur, little meibomian cyst on the eyelid, some arthritis, and he had surgery a couple months back for bladder stones. And
that would lead to the PU, sure.
Yeah, so the PU site itself it wasn't looking so good. It was my first time meeting this guy, but we had to take care of that. So it kind of, it was. I know we're talking about hotspots tonight. This was hotspot 2.0. There was just, after shaving away the hair in that area, got a lot of necrotic debris out, and dried blood and urine scalding, and we just had to shave it away, and got him on antibiotics. And I know we'll touch on all the treatments for pyoderma later.
We'll get in there, certainly. Yeah.
But it was a little nasty. But the little guy's hanging in there, and honestly, he's been urinating just fine since the surgery.
Good.
So that's the most important thing. But that was an interesting finding today amongst the diabetic patients and some hypothyroid dogs, and all sorts of cool cats and dogs peppered in throughout the day.
I've seen my share of PUs. It's mostly cats, but we've done them on dogs. But it was set the poor cat up over the edge of the table with his little feet hanging down, and just go to town. So it's
I say hi to my little friend back there.
Oh she wanted to be in the show. So. Anytime I'm in a Zoom meeting these days, she is like, "Am I in there? Am I in the show?" So. She likes to peek around, but so last week we talked about parvo, one of the grossest diseases dogs can get. And this week we're going to talk a little bit about some of the gross skin conditions we see dogs getting. So this week we're going to talk about hotspots. So let's start with, what's a hotspot?
Yeah. So a hotspot is it's a skin lesion, so a change in the skin that often will present itself as a little focal, like one little area of redness, inflammation, that usually a dog will be scratching at like nobody's business, and it may acutely arise, not something that's been there for a while. An owner might notice it earlier that day or in the week, that maybe started off pretty small, maybe like penny size, and then all of a sudden within a couple hours even, it can kind of get to ghastly proportions. But often it's, self-induced. There's this, dog will, whatever the underlying cause is, a dog is going to go after it because it's pruritic and itchy or painful. And they're going to start licking or scratching depending on the part of the body where it's located. And that's just going to kind of start perpetuating this vicious cycle of itching and licking. And that's essentially what a hotspot is. It's also known as pyotraumatic dermatitis or moist dermatitis. And, it's self-traumatic. A dog may mutilate his or herself. And that's really where the brunt of the disease, or calling it a disease is not really the right thing. Like we had parvo last week on our talk show. It's not so much a disease, but I think it's important to think of it more as a symptom of, whatever the underlying disease process is. And it could range from fleas. That's one of the biggest ones that I think of. Flea bite or whatever, insect bite hypersensitivity, environmental allergies. Some breeds are predisposed if they have skin folds. Think of Shar-Peis with all their folds on their face. Pugs, a lot of moisture can be trapped in there. So, whether it's moisture from that or from after going swimming or, getting water in the ear canal, all sorts of things that can kind of trigger bacteria proliferation and this itchiness. So I'd say that's what hotspot is in a nutshell.
So can any skin issue be called a hotspot, or does it have to meet specific requirements?
I wouldn't say any skin issue. Definitely there's specific requirements, but not every single specific requirement is going to mean that it's a hotspot. So typically, like the actual lesions that I'm looking for, like the dermatologic changes, will be little pustules, sometimes epidermal collarettes, and that's kind of like a pustule that's popped. It kind of makes that little circular rim around the skin. Those are kind of the primary lesions that I'm looking for. And often, they'll be ulcerative. So, with superficial pyodermas that are just really kind of on the skin surface, they're going to be red, inflamed. There may be a little oozing at the center, if there's pus and exudative lesion. Those are really like the actual changes of the skin that I'm looking for. So not all skin changes are going to be representative of pyoderma.
Do you know where the term hotspot came from? Is it just because it rhymes and it sounds cool and it's cool to say?
Yeah, it's a great question. I honestly don't know. I remember hearing it back when I was a first-time dog or co-dog owner, when I got my Westie and I was 6 years old, and maybe a couple of years down the line, she had her first one. We brought her to the vet. They called it a hotspot and piqued my interest. But that was the first time I recall hearing it. But I actually don't know. Do you know where it comes from?
No, I just figured it's people like rhyming things. So it's a spot that's hot and inflamed. So I've known it as a hot spot my entire life, and and I'm so shocked that your Westie would have skin problems. They never have any. Yeah. They never have any skin problems.
Neither do bulldogs. So yeah.
Oh, bulldogs are I had a golden retriever a long time ago. I raised it for Canine Companions for Independence, CCI. They raise dogs for people with physical handicaps or disabilities. And I was a puppy raiser, where you get these dogs when they're 12 weeks old, and then you raise them until they're 2, and you teach them. That's a
wonderful job.
It is.
Oh my gosh,
basic commands, and then you send them to CCI has locations around the country. They've got one in Orlando, Northern California, Southern, and you take them, and then you turn them in. You have to give them away for advanced training. And that's when they learn all the big stuff, picking things up on the
Mm-hmm.
floor, opening fridges, and turning on and off lights.
Wow.
And so he had skin issues, shocking, a golden, and he would get hot spots all the time. And he didn't make it through the training program mainly because of his skin conditions,
Mm-hmm.
because they said we can't expect somebody who has physical limitations
Yeah.
to care for these hot spots all the time. So I ended up actually adopting him, and
Wow.
I had him until he was about 12.
Wow.
And he had a brain tumor. We had to put him to sleep. So another shocking thing with a golden, getting a tumor. But
Yeah, they get epilepsy, they get tumors. It's rough, man. Being a pure breed dog.
he was awesome too.
Ashkenazi Jew, I can relate, just with all the genetic abnormalities that, Eastern European descent. I feel like, interbreeding, pure breed dogs, they have all sorts of stuff. But how wonderful that you kept them for so long. And
I know everybody
what
loved him. His name was Dale.
Dale. Nice.
And he was, I would take him to the mall and leave him across the mall under a bench, just laying there, and he would stay, look at me, and I would walk across the mall, and I would sit there, and he would look at me, and I'd look at him, and eventually I'd go, here, and he would get up, and boom, he would run over to me, just because they had to learn all this stuff. Yeah, you take him everywhere, just like somebody who would have him does it. It's a wonderful program, CCI, if anybody's interested in becoming a puppy raiser or donating or helping. You can't watch the graduation ceremony without just tearing up, because it's, these people have a life now because of these dogs, and these dogs love them. And when they have the graduation, the puppy raiser gets to come and present the dog to the new owner.
Oh,
and
I love that.
It's a lot of the whole time. And it's brutal. So, but I also want to let people know, if they have questions about hotspots or pretty much anything, just if you've registered, type it in the chat, and it'll show up here on my screen, and we'll talk about it. Speaking of Goldens and Westies, are there breeds that are more predisposed to hotspots, or can any dogs get them?
Yeah, I mean, really any dogs can get them. I think Shepherds, Collies, Saint Bernards, Goldens, as you've mentioned, with Dale, are definitely those that are maybe overrepresented, but I've seen them from Chihuahuas to Great Danes. So really, it spans the gamut. I can recall seeing a Golden maybe around 2-3 months ago that, there is this underlying component of food allergy that he has, pretty severe chicken allergy that kind of led to just kind of all over his belly. It was localized there into kind of his thighs a little bit. But he was licking up a storm, so we had to do a pretty crazy shave job and get all the. I'm not a professional groomer, by the way, so I'll see patients, and to determine the extent of the lesion, you want to kind of go beyond the edges that you can see, just to kind of determine extent. But it's definitely not, professional groomer quality. Hence prevention, which we can get to, the importance of that. But yeah, I mean, once we were able to it looked like it was pretty localized, just maybe the inguinal region. But then as we were able to shave some more hair, we saw how far it extended. And yeah, this guy needed to be on antibiotics for, I think he was on it maybe for close to 6 weeks. But it's looking a lot better. And he's not on a chicken-based food anymore. And but yeah, so Goldens are definitely one of the breeds that we see.
Yeah, that's our solution to everything. Just shave it. That's pretty much what. We've had, in my experience, some of the clients that do dog showing, they don't want you to shave their dogs because their dog has a show or something coming up. Yeah, and we would just sorry, oh no, and I mean, we've had dogs come in for C-sections that they wouldn't let us shave. They were like, no, you're not shaving it. And we had to shave basically a clippers width.
It's like, what are you supposed to do?
Alcohol
Yeah?
the hair, and it was like a border collie. So
Oh my gosh!
we had to alcohol the hair down because
Wow.
the doc was like, no, they said don't shave it. I'm like, I'm sorry, we're the veterinarian.
Yeah.
Nah.
So sometimes
Sorry.
like it's important to, with all due respect, like if it's especially for like a life-threatening thing, like
Right.
you have to do what you have to do, and this is definitely I mean, obviously superficial pyoderma, these hotspots are not imminently life-threatening. They can become chronic lesions, but the biggest thing is that they're upsetting the quality of life of our of our furry friends. So definitely that's one of the first things that we do with therapy.
Could it become life-threatening if it gets to a point to where if it's untreated, can the infection take hold and spread and that kind of thing?
For sure. I mean, for sure it can. Especially becomes a deep pyoderma. If a dog, we'll get to the treatment and physical barriers, whether it's some bandage or e-collar to prevent licking. Very simple things. But if untreated, pruritus is one of the most true, like itchiness is like one of the most painful things like that we can experience. Obviously, like maybe like tearing a cruciate ligament, or there's all sorts of horrible ways to go or to experience pain, but true like pruritus over your entire body is really debilitating. And hence the importance of prevention with flea and tick prevention, which we'll get to.
We'll get to that. Yeah.
But yeah, I mean, it definitely. I personally have not really seen cases that it could, a pet could become septic, but a deep pyoderma that a dog is constantly going at, that becomes it can become a horrible problem. And I'm sure it. The skin is the largest organ in the body, and
Right.
this sort of pathology spreads like wildfire. So definitely, most owners can kind of catch it rather quickly. Maybe they'll let it go on for a little too long, but most definitely, like all things, if untreated, can become quite problematic.
Is this one of these things to where the more the dog licks it, the more it itches? So then the more the dog licks it, it's like a mosquito bite when you scratch it till it bleeds and scabs because you're like, oh, that feels good. Oh, and you're scratching and you're scratching. Next thing you know, you're like, ow, that hurts. And yeah, dogs don't know any better.
They don't know any better. Yeah, it's they're treating it by licking it, but they don't know any better. That it's going to make things worse. So,
is there a more common area on the body to get hotspots?
They can be just about anywhere, but definitely there. I would say the more common areas would be the face, kind of the side of the face, behind the ear, especially if it's like an ear infection. That's kind of the underlying reason why a dog is scratching. So the back of the ear is big. The tail base, like the dorsal aspect, like the upper part of the tail. Yeah, I saw one of those about 3 months ago. Horrible. And it was a sheepdog, so fur galore, or all this hair, and we had to clip and clean that, and the owner didn't realize how horrible and smelly it was, because I think the hair kind of trapped a lot of it, but it was horrendous. But yeah,
go ahead.
No, I'm sorry, what were you saying?
That was one of my other questions, was what are the signs? What do people look out for? I mean, obviously, if you see a hotspot, there it is. But obviously, itching, is there a smell? Can they smell the infection? And kind of like parvo. Parvo has a smell. Do hotspots have a smell?
Yeah, I would say definitely a distinct smell to parvo. Maybe less so with hotspots, but definitely you can smell the infection sometimes. Yeast has its own smell. This does too. And typically the history that I'll be hearing is that the owner noticed it sometimes I'll hear, oh, it started yesterday. And, sometimes that may be true.
You
But
noticed it
usually it's a
yesterday.
couple of days. You noticed it yesterday. Yeah,
Mhm.
exactly. But it's usually nibbling, a dog like kind of nibbling with his or her teeth, licking excessively, or scratching, just with no regard. That's the only thing they can think about. And it may not be like the entire day, but once they kind of get the itch down, and they'll go about their business, go eat, go play, go for a walk. But then when they're bored at home, not really thinking about things, that's when they feel the itch and then go at it. So it may take a couple rounds of that cycle to fully complete before the owner decides to make the call to us.
Okay. So they make a call to you, they bring your dog in, they got a hot spot. How do you treat it?
Yeah, I mean, I guess I would ask some questions before going ahead with treatment. There are diagnostics that can definitely and sometimes should definitely be done before empiric treatment.
Mhm.
But oftentimes, I will be honest, the case, I can mention to the owners, the utility of doing an impression smear where we kind of put a glass slide up against one of those aforementioned pustules that pop it, so we can get that pus and bacteria, get it on a slide, take a look under the microscope, look for specific types of cells, bacteria,
Mhm.
neutrophils. That can be very useful baseline diagnostic. Most owners really don't care. They just want to treat it. And I get that. And I don't always do, cytologies. And don't jump to like the more extensive diagnostics, especially if they're not considering that. So typically, how will I treat it? I'll shave the area, a little bit past where I'm seeing initial redness, or pus, and until I kind of see healthy skin. Shave that area. We have like chlorhexidine, gluconate, topical wipes. We'll kind of clean that up, and then I'll send home with antibiotics. I usually choose cefpodoxime, and recommend once a day. And depending on the severity, or if I see any evidence of like folliculitis and some hair follicles that are affected, I may do a longer course than I would otherwise. But typically, what owners should be thinking about are on the order of 3 to 4 to maybe 6 to 8 weeks for really really bad lesions.
Mhm.
Um, but and we'll talk. I know some of the questions in here may come up with home remedies and
Right.
homeopathic flavors to stuff, but I am of the mindset that antibiotics are super important. Now there are topical ones, and then there are the oral systemic ones, like the cefpodoxime, um, and which can definitely cause some adverse reactions. You can see gastrointestinal upset when we give that.
Okay.
But for me, in the vast majority of cases, the benefits outweigh the risks, because the dog needs, like, the mainstay of therapy here is antibiotics.
Do you
Um,
prefer topical versus oral, or would you prefer
so
oral?
yeah, I mean, you'll ask one vet, you'll get, or two vets, you'll get three opinions. Especially those who are more into the homeopathic trend. And there's the multiple ways to skin a cat. Give the reference. Um, just
Or
the
skin on
skin.
the cat.
Yeah,
Yeah.
exactly,
So,
exactly. The multiple ways to skin on a cat. Um, the goal here is to just stop the trauma
okay.
and to prevent development of future trauma. And so, you know, sometimes cost is an issue. If I have multiple patients in one day to treat, the same essential thing, which is a hotspot, which is often the case because skin and vomiting diarrhea are like the two most commonly histories
Mhm.
that commonly seen histories that I'll see in a given day. but I may treat them very differently, depending on owners' wishes, owners' comfort levels, like giving oral meds. Oral medication is generally some of the easiest things to do, but a lot of people do, for, if they may have disability or they have, problems opening the mouth, like, or they think the dog, they'll hide it in a treat, but their dog's too smart, which is often the case. There are a lot of challenges when it comes to, there's no one size fits all therapy. So generally speaking, I'm pro oral systemic antibiotics for hotspots, but I will not end up prescribing that to all my patients. But in some form, whether it's, a topical, shampoos, so chlorhexidine shampoos, or miconazole, which is an antifungal, but it has antibacterial properties. That's also a really good one. And it really depends. But I'm always going to recommend what I think would be best, which is pretty much always usually cefpodoxime. And that's really based on the typical susceptibility patterns of staph, pseudointermedius, which is one of like the main bacteria that's going to be colonizing on our skin, and that can kind of get in that area and then start to proliferate. So because I know cefpodoxime is going to be indicated for that species, that's the one that I almost always choose.
How do your treatments vary for the underlying conditions, be it dog's got fleas, the dog's got, whatever, the dog's got a food allergy, the reason why they're itchy and scratchy, how does that affect your treatment?
Yeah, I mean, that's huge. I always tell the owners, like, this didn't happen out of the blue. Like, there had to be some sort of stimulus that triggered it. And we may not always find out on the physical exam or based on what the owner has provided to me in the history. We may not know what is the cause for it, but we like to control for some of the biggest ones. And I definitely think flea allergy dermatitis is a huge one. And I always recommend that an owner will, especially if they are not currently, up to date on a monthly preventative, or, every 4 times a year, if it's something like Bravecto, chewable that lasts for 3 months at a time. I always recommend that they get on that. But definitely, like, I'm going to do a full physical exam for every patient that comes to see me. And, if we see a lot of inflammation in the ear canals, or that's kind of the back of the ear is where I'm seeing the excoriations and kind of the redness or, bleeding or anything, we'll do a swab. I'll recommend an ear cytology. We'll try to start treating the underlying cause. And that could be, some otic solution in the ear canals. It could be ear mites. It could be, who knows? Could be anything. Yeah. Yeast, rod-shaped bacteria, spherical, like cocci. So all sorts of different things.
So basically, you're a detective at this point. You're trying to figure out, and you have to treat the underlying condition, because if you just treat the hot spot, you put cream on it, you shave it. Well, if the dog's going to be itchy, it's going to happen again and again and again. Yeah. And that's something we have to communicate with owners and say, listen, I know you don't want to spend extra money for ear swab or whatever it is, but you're going to keep coming back for this, or you're going to try to treat it at home, and then it's going to get worse. How much do you normally shave? Say on a quarter-sized lesion, like how far out do you go?
Yeah, I mean, I think going at least another centimeter or 2 around it would be sufficient. As soon as I kind of see the nice, healthy underlying skin beneath the hair. But yeah, I'm pretty liberal when it comes to that. Unless an owner, like, not even unless, like, they'll demonstrate. Most of the time, people are, pretty understanding that this needs to be done, and they're cool with it. But periodically they'll be like, oh, don't do this, but we need to see what we need to see. So I try to, you know, my hands will be all over their pet, not even just in the specific area that that they're worried about or that the dog's been licking. So if I feel, some sort of crust or something moist in a different part of the dog, I'm going to recommend that we also shave that area, because sometimes these things can kind of fly under the radar.
Right. Yeah. My poor dog looked like a checkerboard when I would get done with him, because I'd be petting him and go, hot spot, and bring him into work and just shave a big old square around it. And then, there's another one, shave it and get him on antibiotics. So that's a constant battle. So,
Poor Dale.
I know, he was a great dog, but, he got a little weird with his brain tumor, though. He started having seizures, and then it was one of those things where, I worked at a specialty clinic with neurologists. So like I'd bring him in and go, help me. And they would look at him and see like half his face is a little sunk in, and they would say, okay, something's probably going on over here. And we put him on anti-seizure medication, and that stopped his seizures, but it completely changed his personality. He was no longer the dog I knew. He'd walk around like, oh, this is new. This is new. Hi, who are you? What's going on? And it got to the point where he snapped at my kid at the time, who was a baby, and he would never do that ever. So it was like, I can't have him around with possibly hurting the baby. So we had to put him down, but it was tough. But anyway, that's a sad story. We're not doing sad stories. We're talking about hotspots. Home remedies for hotspots. Do you recommend people do home remedies for hotspots? Pouring witch hazel or essential oils on a hotspot at home? Do you think any of that helps?
I don't. I would definitely recommend.
I'm gonna get you in trouble with all the essential oil people.
Right. Well, come at me, bro. Essential oil people.
I put peppermint on there. Yeah.
Everyone wants to do what's best for their pet, and there's a lot of there are a lot of natural treatments out there that can be helpful. And like with whatever anti-epileptic drug that Dale was on, kind of circling back to that, no drug is benign. So even the antibiotics, which I pretty much always will be recommending for hotspots, I always alert the owners, for potential side effects. And there are a lot of homeopathic and home remedies that, I did a Google search and preparing for this to kind of see what's out there.
Let's hear it.
Hydrogen peroxide, I saw some sites that say definitely. And then I'm thinking in my head, no, let's not do that.
Why not? Why would you not recommend?
H2O2. H2O2 is, we have it in the clinic, we have it in our houses, in the cabinets, and it's a readily available option. So I definitely understand why people think that it's good for for us sometimes, scrapes, and but it burns, and I do feel that the science behind the oxidative damage, and while it will kill a lot of surface bacteria, it's going to delay the healing process by also kind of interfering with the body's response to the trauma, and potentially like slow healing. Right. So and it burns. It really is no fun. But I did see other things,
and it's also one of those things to where it when we would get blood on our scrubs, we'd spray hydrogen peroxide on it because it breaks it down. It's easier to clean out. Yeah. If you want something to clot or to heal up, why are you dumping something that's kind of caustic on there? You're right. I think it burns. It's bubbling. It's working. And meanwhile, your dog is screaming around the house.
Pretty much. Definitely no fun. So that's something that I would avoid. I saw calendula, which it's a little salve that we have from the marigold plant.
Okay.
It has some anti-inflammatory properties that, if an owner, if it's cost prohibitive to come to the hospital, obviously we would like to see their pet, because we need to kind of diagnose officially, because, it could be something else, but that could be a good option. Aloe vera can be soothing. We don't want, obviously, our dogs to be licking this. So definitely the e-collar for sure is a must. I mean, it's really half the battle, just preventing them from licking the lesion.
I was going to get into that next. Yeah.
Yeah. So, I mean, that's half a home remedy in and of itself. If an owner is vaxxer, anti-antibiotics, no drugs for my dog, which we do have a lot of. I have a lot of clients who are like that, but when push comes to shove, depending on the severity of, if it's skin lesion or gastrointestinal upset or whatever the case may be, then, if it's causing too much of, they decide it, they call it on their terms. But if it's really, they understand that this is a big deal, then they'll obviously opt for certain diagnostics or drugs. But there are a lot of people who don't want that for their pets, for whatever reasons it may be. But yeah,
I like my dogs like I like my chicken with no antibiotics.
There you go. GMO free.
That's right, no hormones.
Not GMO. But yeah, so I think calendula is a good one.
Okay.
Yeah.
So in terms of keeping your dog from licking, can you tell them stop licking and they're going to listen to you, right? That's what dogs do, isn't it? Don't they stop when you tell them no?
Yeah. If only they could, if only we could talk to the animals. Who was it who sung that?
Talk to the animals, walk with the animals.
Yeah.
Oh, I'm going to have to go
something Junior, Sammy Davis Jr.
Okay.
So anyway, if only we could talk to the animals. We can. They're not going to talk back. And if they did, they would be like, "Hell no, I'm going to be licking this."
So what do you do? How do you keep them from licking it?
So the cone of shame, Mike. That's the answer. The cone of shame, the Elizabethan collar. Yep. That's the key. Now, some owners don't like that. They want the soft collar. And I'm okay with that so long as it's truly going to prevent that, like depending on the location of the hotspot. For soft collars, they could probably potentially still reach at the tail. But if it's kind of, on the back or the flank, the soft collar might do the trick. But you just need to create some barrier from the mouth to the actual lesion. And I always recommend to owners, and sometimes, they'll, while they're sleeping, or at the house, they'll put it on, but throughout the day, if they're home, especially now during COVID, when a lot of people are homebound, they'll, have it off because the dog is happier, but they'll just monitor from the background. But inevitably, like, the dog will still be licking, and the proof is in the pudding, because when I see them back for a recheck or something, you can tell,
right.
You see the surrounding hair that might be a little bit, wet, or, it's happened. So, but the most we can do is, recommend, and hopefully the owners will, listen.
Yeah. For me, it's working in a surgical practice. We would send home the collars all the time for the dogs because they have incisions. You don't want them licking.
No.
And for me, it's there's so many different types of e-collars. You can buy them in the store. You can buy them, wherever. You've got the regular e-collar, the kind of white plastic. There's clear. They've got black ones. They've got the inflatable donut collar. You've got the bite knot collar that looks like a neck brace that they wear, and it's got the strap that goes around their front leg so they can't get it off. For me, when you're buying an e-collar, if you want to buy one at the store, you need to make sure it goes beyond their nose when you put it on. I see so many people come in with an e-collar that's back, at their ears, and the dog can get around it. And yes, your dog's going to hate it. He's going to hate the e-collar. He's got this thing on his head. His head is all of a sudden twice as wide.
Yep.
He's going to run into doorways. He's going to freak out, and you're going to feel sorry for him. And yes, you're going to take it off, and they're going to go to town on licking it, because as much as we love our pets, we can't trust them to not do what comes natural to them. And yes,
Sure.
if depending on where the lesion is, and that determines, at least to me, what collar you need to wear. If it's something that's up here on their shoulder, then, you know, an inflatable one will probably be just fine. But if we had dogs with knee surgeries that they would put the inflatable on, and the dog just curls around the collar and licks all his stitches out by the time he gets home.
Yeah.
And
they're very resourceful. They're very resourceful.
All they have is time.
Yeah.
All they have is time and a desire to lick. So that is
the surgeon's worst nightmare. All the, you know, the sutures, all the work that they've put in, and then it could be done it could be all for naught within a few minutes of licking and chewing.
Yeah, and we've had to redo like TPLO surgeries because the dog has gotten in there and just chewed the fool out of his incision, his muscle incision, and it's all apart. And you know, the dog, it's not the dog's fault. Dog does what a dog does.
True.
Yeah.
True.
And also in the audience, we've got about 10 more minutes. If anybody has any questions, put them in the chat. If you registered on the page there, the Rockwell Pets page, and it'll pop up and we'll answer them. So we shave the hair, treat the lesion, put them on antibiotics, put the e-collar on. You said depending on the severity, you're looking at maybe 6 to 8 weeks. So it's definitely not an instant. You're not going to shave it. The dog's going to come home with perfect skin. Everything looks great.
Yeah. Owners have to be that, you know, and they should understand that this is not going to be, an overnight process. And sometimes they can heal remarkably well, especially younger pets. But yeah, I think that they should be realistically looking, depending on the severity and extent, you know, several weeks. And generally, it's, you know, the official guideline would be to finish the antibiotics, be a 1 week past resolution of symptoms.
How can people prevent hotspots?
That's a great question, Mike.
Can they prevent hotspots?
They can. They don't always need to go to the vet when it gets bad. They can reduce the frequency of needing to come to see us by taking care of, some very, very doable, frankly, preventative measures. So first, and probably the biggest one that I could say, would be flea and tick preventative. So it could be of the oral variety. You know, you got the Bravecto option. You could do topicals. You could do the Seresto collars. A lot of different options to go here, but that would be the biggest one for me, because I feel as though that's one of the. Forgive me. Got my cousin calling through. We'll talk to him.
If he
later.
wants to ask a question, just put him on.
I'll send him through.
He didn't have to call you. Yeah.
Fleas and ticks. We want to get them off, and flea bite hypersensitivity is one of the the big reasons here. Ticks, maybe not so much. It's very. I've seen dogs who have like hundreds of ticks on them. It's awful. Usually in the summer and the springtime. But actually, last month here in New York, we had this blizzard, like late December, and I had a Westie come in with a tick on him, and middle of the winter, it was like 20 degrees or something. It was crazy.
Wow.
But really, I would recommend year-round prevention. And even if the risk is less so in the winter months, fleas can be anywhere in the household. And I think the cost relatively of prevention is far below the cost of treating when kind of times get rough.
Sure.
So that's the biggest one that I would recommend as a vet.
And the hassle of treating too. It's not just the cost.
Yeah.
It's the hassle of giving your dog
Yeah.
meds, giving your dog an
Yeah.
e-collar, dealing with the dog bagging in the back of your legs
Yeah.
with the e-collar.
And the fact that it's gotten to that point,
Right.
they're feeling badly from it. So, I'm all for preventative medicine. And I think that's one of the biggest gifts that we can give to them, just because, they're not showering as regularly as we are. They have hair all over their bodies, and we can't be checking. They can't talk to us when they initially get an itch. So,
is that another
one.
prevention? Bathing? Is that keeping them groomed, keeping them
So
brushed?
yeah, exactly. And don't necessarily see your vet to get groomed, because we won't do a great job at it, admittedly. Especially for like the long-haired dogs. I had a Schnauzer the other day that matted fur all over her body, and she did have an infectious wound. Unfortunately, there's a neoplastic or cancerous underlying cause. So she's going to be coming in for surgery. But it was just kind of a necrotic infected wound that it needs to be surgically repaired. So, a lot of these, pyoderma, if untreated, or if there's, a separate cause, there's all sorts of other things that you look for. We didn't really talk about endocrine diseases, like Cushing's, that can kind of show some skin changes, but sometimes you can kind of see stuff that we've been talking about with Cushing's. But yeah, this dog, long story short, she had matted hair everywhere. And I just wonder if, if she had been groomed and gone to somewhere, maybe at least, seasonally, this could have been not necessarily prevented, but picked up sooner in the course of infection.
Right.
Yeah.
What about diet?
Diet is a big one, especially, dogs who have a food allergy, and it may be established earlier on in the course of life, or if an owner is kind of playing around with different brands and, different protein sources, and it's kind of all a mix. And then you get the diet history, and then you're like, oh, you have these raw foods, you have rabbit hide or some crazy thing. And I'm like, where do you get this stuff? And you get this boutique variety food, and it's just all over the place. Diet's definitely something that I look at. It may not be the first thing that I think of when I think of hotspots, but definitely if there's a recurrence, and we've treated it successfully, a couple months later it comes back, maybe there's also concurrent GI upset, then definitely I think of those historical issues as potentially being related to diet. I need to find out from the owner what the protein source is. Have you given it anything besides the food? And depending on what the case may be, we may be recommending some different diets.
And that's where your experience comes in, to be able to see the different pieces and be able to put it together to get a complete puzzle.
Oh, for sure. Yeah.
So yeah. I want to let people know they can go to rockwellpetspro.com and use the promo code SPOT, SPOT, not the name of your dog, but as in hotspot, for $10 off probiotics and natural dog bone broth with turmeric, which sounds delicious. I might have to have some of that later. But dog bone broth, it sounds weird. So we're just about done here. We didn't have any questions tonight, which is very sad. Hopefully next week. Next week will be on Thursday night. And what are we going to talk about next time? Do you know what we're talking about?
I think it might be ringworm. I think that one might be in the pipeline. So
ringworm, which is not a worm. Spoiler alert. Yeah, so
we'll say that for next time. But yeah, biggest misconception there.
That's right. Yeah, it's got to be a worm. So before we wrap up, Dr. Max, is there any message or anything you want that we haven't gotten to yet that you wanted to get out about hotspots, be it prevention or whatever it is that you want to tell us about hotspots?
Yeah, I mean, hotspots, if you have a dog and if, especially if it's a long-haired dog, for example, it's very possible that he or she may have one during his or her life, and but they're treatable, and especially if you kind of recognize the signs early on, and bring him or her to your vet to be seen. It's something that can be fairly easily treated with good prognosis. But definitely, trying to find out what could be the cause is going to be always the most difficult part of, our job as the detective. But we can kind of help you figure out what the best course of action is. I once had, it was from contact dermatitis, and thankfully I had adequate self-control to not. It was crazy. I got it like I was out in Maine and with my cousins, and it started on my temples and it just traveled down to my chest and arms. It was ridiculous and scary, and thank God thus far, and hopefully not anytime soon, the only time that I've experienced this. But the skin is a crazy organ. It's our largest one, and it does weird things, and being itchy is just one of the worst. It's one of the worst feelings, and hotspots are a manifestation of that. So prevention is key. Spotting the early hotspot signs is key, and together we can figure a way to keep your pet happy.
Very cool. But I want to thank RockwellPetsPro.com. Once again, you go there, use the code SPOT, and you get $10 off probiotics and natural bone broth, natural dog bone broth with turmeric. Otherwise, I think we're done. I think we've beaten hotspots to death for the last hour. It's been great. We'll be back next Thursday with ringworm. Thank you, Dr. Max. Hope you have a great week, and hope everybody feels better up there.
Amen. Hey, you too, brother. You too.
Yeah, I'm getting over it. So we're all good down here. So otherwise, we'll see you guys next week. Have a great week.
Bye.